Well, welcome. Tonight we're going to meet somebody that's not your typical Milfordian complainer. We've had too many times when people have complained about what's happening in town and yet don't get up and vote. And more importantly, don't take a position of put me in, coach, I can help fix things. Let's start again. Well, welcome. Tonight we're going to meet somebody that's taking the extraordinary step of not just having an opinion of how to fix things in Milford, but willing to put the time and effort in to help the Board of Health become better and better service. So why don't we start with an introduction?
Thank you. Thank you. First of all, thank you for having me here. It's great to be here and be with an old friend, back from high school.
High school.
To here. But it's a pleasure being here. The reason why I'm running is because we have an open seat. With Lenny Izzo passing away just a few months ago, there's a huge vacancy, and I have to take a few minutes to thank Lenny's family for all those years that he put in, decades that he put in to the Milford Board of Health. And I don't know if we ever really recognized him or Paul or Lori or anybody else, but they're big shoes to fill. And my hope is that I'll be able to fill those shoes. Why am I running? It's because I want to pay back to the community. This is my hometown. I grew up here. We went to high school together. I went off to college, became a nurse. I worked very hard, became a school committee member for a few years, precinct 6 member for many, many years. And it's time, I think, that I go back into the community, and my goal is to make every citizen safe and as healthy as possible, because there's a lot of unknown things coming down the road. I've been really thinking about this, Al. 2019 was the beginning of COVID. Okay, it didn't hit us until 2020, and we were not prepared. We were not prepared. Working in the hospital, I worked in the emergency room, taking care of COVID patients, intubating, trying to save their lives, people coming in with, having heart attacks and pneumonias, and we had to lie them on their belly to help them breathe. And we ran out of N95 masks. We ran out of hand sanitizers. We ran out of our PPEs, the outfits that we have to wear to protect ourselves. We ran out of everything. You'd go into Shaw's and you'd look, and half of the products were gone. You couldn't even find toilet paper. Do you remember that?
Oh, yeah.
And so a lot of people that was in the past, it's not going to happen again. But we don't know what the future holds. And I want to make sure that we have a plan in place. So the Milford Board of Health, it's amazing what they do. They really do a lot. And it's not just trash pickup and recyclables. It's not just, flu clinics and looking at the restaurants and doing inspections. It's so much more. But my biggest fear is that we're not going to be prepared if something happens down the road. So during COVID, for an example, when we ran out of N95s, I went out into the community and I went to Koopmans, I went to Home Depot, I went to Lowe's talked to managers to see if they could give us N95s. I was willing to pay for them, and they donated boxes full. It was great. It was great. So the community came through to help us. Our N95 masks, you know that they're very tight. So the back of our ears, all the nurses and the doctors, we had no skin left on the back of our ears. Our faces were scarred from those N95s. And so we relied on community members. I put something out. I remember putting a help wanted or help needed out to the Milford Bulletin Board. And people responded right away, where we had people like my neighbor, Grace Hill, and I have to thank her because she came through. She made so many of those little knitted bands with the 2 buttons on them so that we can hold those masks up against our head so that we could preserve our skin. So it was that time that made me really think about all the things going on in our community and how the community came forward to help us. Another example was the Lions Club. One of the things I noticed when people were admitted, the separation of families with patients, right? My sister-in-law, I don't know if you knew that, my sister-in-law actually passed away from COVID.
I didn't know.
Yeah, it was
Sorry
Joe's
for
first
your
wife.
loss.
Yes, there were only 10 of us at her funeral. It was like the worst time in history for us. 10 people were allowed to go to her funeral. Everybody had to have a mask on. And she was a woman that all her life, she did so many wonderful things, had so many wonderful friends, and only 10 people could go. So it was bad. It was a bad time. But anyway, in the hospital, I noticed that families were separated from their loved ones. We had to keep everybody in quarantine. So everybody was locked down units, rooms, and people couldn't communicate with their family. So I saw that, and I'm like, we got to do something about it. So I went to the Lions Club, and I asked them, and I said, is there any possibility that you guys could donate, say, tablets, so that people could do FaceTime and could talk to their loved ones because they were quarantined. And once you brought something in there, it kind of stayed with the patient. And then anytime you brought it out, it would have to be sterilized and all of that. So they came through with 7 tablets. And then I'm also on the committee for My One Wish. And so My One Wish came through, and we were able to get 1 or 2 more tablets from them as well. So we had enough tablets that we were able to spread through the hospital so that families could keep in touch with their loved ones. So that's just like an example of the things in the future that we don't know, okay? The other thing I'm looking at is, do we have, now I have a background in emergency preparedness. So I was a federal employee, volunteered back in 2001 when, September 11th, 2001, okay, right after that, I joined the federal team. It's called Disaster, it's DMAT 2. So we have DMAT 1 out of Boston. DMAT 2 is Central Mass and Worcester. At that time, I was working for UMass. So it took like a year of training to be able to go out to disasters and things like that. So our job back then was flying out before the hurricane hit. We would be stationed in the area. So for example, Hurricane Ivan. So Ivan, it was Pensacola area that got the worst of it. So we'd fly in on the military planes, and we'd fly in 2 days before, and our job was to evacuate our elderly population, because remember, kids and the elderly are the patients that are most prone to debilitating and
Yeah, they were
life-threatening,
disproportionately at risk.
at high risk. So our job was to evacuate as quickly as possible. So we evacuated a lot of these elder patients. We had to make sure that they had enough medications for at least 5 days. We had to make sure that there was a bag with some clothing for them. that kind of thing. And the big thing was we had to verify where they were going, who their family was, and let their families know where they were going. Because can you imagine, like, hundreds of people flying out all over the place? And now families are like, where's dad? Where's mom? Can't find them anywhere. So it was really important to keep very, very tight records of those people. Okay? So with climate change, we're seeing more and more hurricanes, tornadoes, earthquakes, floods. And my worry is, do we have any kind of plan in place? For instance, hurricanes, you know days, weeks ahead a hurricane is coming. But you don't know if a tornado is coming.
Mm-hmm.
You get a bad storm and a tornado hits, you have no warning. So one of my goals, if I'm elected, and I hope to be, is that I work with people like Mark Nelson, emergency preparedness. And what does Milford have? What kind of plans do we have? What kind of plans do we have in the school? What if we have a tornado and kids are in school? Do the kids go through training? We go through training for shootings, right? Fire. But are there trainings if there's a tornado that hits? At the hospital, there is training, and we call it Code Orange. Okay? Code Orange is our tornado warning, and we have to move all our patients out to the middle of the hall, away from glass. There's a bunch of things that we have to do. Do we, at the schools, have anything? Do we, at nursing homes, have anything? And I think that under the Board of Health, it's something that we should kind of look at for the future, because we don't know what the future is going to hold. But, you know, the Board of Health does a lot of really important things, but there's a few more initiatives that I would like to see come forward. So I'm hoping that my past experience working on the disaster team, my past experience working with the school committee, working with the school committee on budgets, updating policies, reconciling complaints, following up, things like that. I'm hoping that that will help me become a better member of the Board of Health, where I can help the town of Milford a little bit more. So I'm running because it's a perfect time. Lenny, unfortunately, passed away. There's an open seat, and I feel with my experience that I am the better candidate, and I'm hoping that on April 7th people will come and vote for me.
It's wild when you talk about Lenny and Kenny Evans, and
Yeah,
when Paul Mazzucchelli used to come on the show, we used to call him the newbie.
and Paul's been there for what, 40, 50 years?
38 years or whatever it was at the time, and
Huge.
the other two were in their 40-year brackets.
Yeah, but imagine all the knowledge that Paul has.
Well, it's good that he's still around and still
glad.
active.
Because he can kind of guide everybody through. And I'm not going to be there for 3 years. I'm going to be there for many, 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 many years, because I really feel that this is my calling. I really do feel like it. And I'm hoping with my past experiences that that's going to help and contribute in making me a better candidate.
A profound area where you say, old Portuguese saying, those who don't study history are doomed to repeat it.
Yeah.
You know, and I think of those N95 masks.
N95, yeah.
I could not find one.
Yeah.
I got lucky because we deal with a lot of countries, and my distributor in China read how scarce they were and sent me a box.
Yeah.
Of course, half of them you donate.
Yeah.
You just have to.
Yeah, you have
But
to.
if I didn't have those masks from him, I don't know that I would have found any.
Yeah. And we don't know what's going to happen down the road. It may not be COVID, it may be something else. And, you know, we need to make sure that we're prepared. And I need to, like, do some research and find out. Do you remember growing up, whenever there was a fire, how would you know where it was? Do you remember those days? Living at home with your parents, how would you know? Do you remember? I remember getting a card in the mail, and it had all the codes for all the streets. So we had a siren system back in the 70s, 70s and 80s. It was a siren system where, if you heard boop, boop, and you looked up, oh, it was 2, you could see, oh, it's Walnut Street, or it's this. Remember that?
Yeah.
That went away a long time ago.
And that's amazing because today with the internet, you
Yeah.
assume you'd know
You
right away.
assume that you would have a reverse 911 for everybody would be on that, so that you would get your phone and it would alert you right away. Like, again, a tornado, it would alert you right away, but not everybody has that. So how do we alert people? How do we alert them to stay put, get shelter, that kind of thing? So it's something that I've been thinking about and looking to see if we have any policies on that, any guidelines as to what to do, and then go from there.
Do you
It's
see
gonna
the
be-
Board of Health being the central player in that?
I think the Board of Health, remember, the mission is to provide safety, and health, and make our citizens as healthy as possible. So I think the Board of Health, along with the fire department and the police department, I think the 3. That's what I think.
Well,
I could be
That
wrong.
makes sense because when you talk about preparedness or implementation at the hospital,
Yeah.
one name comes to mind, Jeff Hopkins.
Jeff Hopkins, and what we do with Jeff, yeah,
But you
Yeah.
turn around and say, okay, that's at the hospital.
yeah,
And I mean, because of his nature, he'll go out of his way to help everywhere.
Yeah.
But who in town, if I run into an issue and I want to call somebody? So I like
I
your
don't
idea
know.
of the Board of Health working with police and
with
fire.
police and fire, yeah, and probably with the school system, making sure that the schools have guidelines as to what to do, because you could have a tornado and
Well, you have to
April
include the school
1st.
system because you think about it, the high school is our number one disaster place. When there's a disaster in Milford
Mhm.
and people, if you had a tornado, you had a terrible hurricane, and you
Is
had
that
a
one
lot
of the shelters?
that is the main, because of the cafeteria.
Yeah, but the cafeteria's all in glass, so it can't be in the cafeteria. It could probably be in the auditorium.
No, I said because of the cafeteria, because you got to feed people.
Oh, because of feeding people. Oh, but I'm thinking tornado. That would not be a good place to
You
put
wouldn't
people.
want to have anybody
near
surrounded
glass.
by glass.
No.
But if you think about it, if they're going to be there for days, you got to feed them.
Yes, you got to feed them, and you got plenty of space to put cots in. If you
And
have
you've
to
got
put
Carla.
cots,
So as long as Carla's involved, I know everybody gets fed.
and it's going to be good,
It's going to be good food.
right? It's going to be good food. But anyway, yeah. If that answers the question as to
So
why I'm
now,
doing this.
if we were to ask you, what is the main objective of the Board of Health? What is their mission statement?
The mission statement is to provide safety and a healthy environment for all our citizens, because we want everybody to be healthy, and it includes environmental health issues. It includes things like school issues, what's going on with our schools, not just food, but tracking things like measles and communicable diseases that may be happening in the schools. It's looking at not just like trash pickup, but I'm trying to
But
think.
let's go through diseases.
Yeah.
For the longest time, there were certain diseases I never thought about.
Yeah.
TB.
TB. Yeah.
Been eradicated in my mind.
It
and
was.
yet,
Yeah.
a few years ago,
Mhm.
it showed up in Milford.
Yeah.
And it makes sense because you've got people coming from different parts of the world
Yeah.
where TB is still active.
Yep. But what's happening right now?
Measles.
With measles, exactly. The last time I looked with CDC, about 1,200 cases, and 90 to 100 were hospitalized, and they end up with a lot of brain swelling, pneumonia, but no deaths. Massachusetts, we're really good with immunizations, but Massachusetts had 2. But luckily, 1 was a child, and it was during school vacation. And so they presented with symptoms outside of the state, and so they're quarantined, and they never really
Made
came
it
into the
back.
state. Yes. So that was 1. And the other one was somebody internationally who traveled internationally, yes.
Well,
But we know that 90% of those cases, 90%, it's documented, were not vaccinated. New England, Massachusetts, high vaccination rates. So we're not seeing what South Carolina is seeing. We're not seeing what Florida is seeing or Texas is seeing. Not yet. But, you know, if parents make that decision that they don't want their child vaccinated, then yeah, we have to think about measles outbreak and how do we handle it. And you know, measles, it's going to be most likely a child
It's gonna be the
in
kids.
school, yeah. And so what is the plan? What is the plan if something should happen in the school?
well, years ago, the FinCom and the Board of Health together caught a lot of grief over increasing the budget for the VNA to take care of TB. I mean, I had people coming up to me saying, you're prioritizing
Yeah,
immigrants over Milfordians.
yeah.
And I was kind of taken aback because I said, you know, I'm hoping that people believe we're doing this for the right reasons.
Yeah.
But if I want to be perfectly candid, part of me is doing it to protect my family.
Yeah.
Because if a kid goes into a classroom with TB,
Yeah.
it's going to spread throughout the classroom.
It is. Yeah. It is. It's going
You
to
know,
spread. Yes.
So it brings up the whole topic of VNA.
hmm
How do you feel about us using VNA resources?
So, I've been thinking a lot about this. And I think we have to sit back and analyze everything, because I know that with this current administration, we are not getting the funding that we did last year or the year before. We're not. So we've got to think about how do we get the most for the dollar that we put in. So VNA, they're important. They're important for things like, I know that they cover the senior center. I'm not sure if it's 1 or 2 days a week. They're there just for a few hours. We utilize them for the flu clinics that we do. Okay, but we also have, and I've been really thinking about this. We also have school nurses. We have our own nurses. And we have substitute nurses that come in whenever there's a nurse out on maternity leave or they're out on an illness. So we have the pleasure of having our own staff. And we have a part-time town nurse, Mary, who is a nurse, and she's still licensed under the state of Massachusetts. She has an active license. So I'm wondering, can we tap into our own resources? And people have actually, some of my nursing friends have actually approached me and have said, you know, we're retired now. I would love, 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 love to be able to volunteer. Volunteer. So we have people that I think would be interested in volunteering and coming in and helping out whenever we need it. So I really have to sit back and kind of analyze everything and really do some research and see, is it a good thing to continue this relationship, this partnership, or is it time that we think outside the box and look at other alternatives, especially knowing that we're foreseeing a severe cut in our budget. I don't know.
That's going to be the outlier that can affect everything. Because we've got one indication of what the budget will look like for next year. The governor proposed Chapter 70, the school funding, go up 0.6%.
Going up?
Up 0.6. But if you think about it, 80% of the school budget and most of the departments are labor. And those are in 2 to 3% increase.
And you can't get out of that.
So all of a sudden you
Union
turn around and
contract.
say a 0.6% increase, at best, is a 2.5% cut. And I can't imagine it's not going to filter through every department.
Oh, I'm sure it will. I'm sure it will.
Because the school is 62% or so of our spend as a town. And it's not insignificant. We got a $180 million budget. 60% of it, if we got to find 2% in there, you can't go back too hard on departments like police, which have 94% of their budget being labor.
Yeah. Yeah.
So, you turn around and say, what you mentioned is profound, that we've got to do more with less.
We have to. We have to see where we can curb our spending, but not jeopardize the services that we offer to our citizens.
Well, that was with the TB outbreak, and I know that people say it was only a few cases. Well, it's kind of like when one of our presidents said, the economy is doing fine, the unemployment rate isn't critical. As long as you're not one of the 5% that's unemployed, it's not critical.
But if you are,
If you are, it's like
Yeah.
as long as you don't have measles or TB,
Yeah.
it's not critical. But the minute you are, we paid the VNA to go and make sure that people would take their medicine. Sounds silly that you give people medicine, they wouldn't take it.
Yeah.
But a lot of the people came from areas where they didn't trust the government.
Plus the TB medication, it's a hard one because you should be under a certain age and it can cause some liver problems. So you have to have follow-up lab work. You have to look at those liver enzymes when the patient is on it. So it's not just giving them the medicine for TB. You have to do follow-ups and make sure that that their livers are being able to cope with it and their enzymes are not elevating.
And the trend now that's disturbing, at least in my mind, when my mother had her knee replaced, she had a week to 2 weeks of rehab. I'm hearing now they're trying to make it an outpatient surgery or give you 1 day.
Oh, Tony just had his knee replacement.
Oh.
My husband just had it, and he went in to a surgical day center and came home the same day with physical therapy already at work. So he met with the physical therapist, and then they came to the house the following day. Oh yeah, medicine has changed quite a bit. No more inpatient. You have your knee replacement. You come home the same day.
And that's a scary movie because your Tony came home
Yeah.
to a different environment than a lot of people have.
Yes, and he had a wife who was
Who's
a nurse, who, was
But I mean,
there
from-
very helpful, making sure that he took his pain medicine, ice the knee, elevate the knee, yeah.
From a basic standpoint, he had a wife. He
Yes.
had family.
But if you don't, you end up going to rehab because you can't.
But you sit there and say, if you're sent home and there's nobody, you're alone.
Yeah. Yeah, but if you're by yourself, yes, they assess you, and you should be going to like a rehab for maybe a week or 2 weeks until you're able to.
If the
Walk
insurance will
around.
pay for it.
Hopefully it will. Hopefully it will.
Because I can't imagine that most people would turn down rehab or would say,
Yeah.
oh, I've been in the hospital a day, I can go home now.
Yeah.
Because I remember my mother on the machine stretching her leg and
No more machines. No more machines, Al.
But that did so much for her
Yeah.
recuperation.
Now it's walk, 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 walk every hour. Walk. Yeah.
Wow.
And then they put these little pads on your legs to prevent blood clots. So it inflates and deflates, inflates, deflates, and you use a lot of ice, and you walk a lot.
But that's an interesting observation that we have a lot of people at home that were or are nurses that just retired.
We have a lot,
That
and
if
they
we
have
could
approached me.
engage them,
They've approached me and said, "Hey, I retired. I'm not doing anything. You know, if there's anything I can help with, volunteer." So I'm like, you know, if we have the flu clinic, we have what, 4 or 5 flu clinics. I'm sure we can get a lot of nurses out of retirement that still have active licenses that are more than willing to come and help.
and
And then pharmacies, the pharmacists. So the Central Family Pharmacy in Milford, they actually will go out to an elder's home, and they came to my mother and gave her her COVID and gave her her flu shot.
oh wow,
So they will actually do that. Yeah, if needed. There's no extra charge, nothing. So if you have somebody older, my mom's 93 years old, and it's hard for her, you know, getting in and out of the car and having to take her to the flu clinic or whatever. So they came up and gave her, the pharmacist gave her the injection. Yeah. So there's resources out there that we can tap into.
and we do have programs where we have a reduction in your taxes if you sign up to help the town.
Oh, I didn't know that.
Yeah, there's program the seniors.
For seniors? Oh, we should do that.
But I mean, you start thinking about reducing a little bit of taxes for the help
Yeah.
that a registered nurse can provide.
Yes, yes. Yeah. Yeah. We would just have to figure out if anything is needed, like, you know, Corey checks or anything
Oh,
weird.
probably.
And
I
that
mean-
would be a Ricky Villani kind of question, right?
Yeah.
To see, but you know, there are resources out there that we can definitely tap into, and if they have active license.
For years, we were reducing people's taxes if they volunteered to like follow the trash trucks around to make sure that everybody was recycling.
Oh,
I mean, if we can fund activities like that,
yeah,
using nurses for health reasons can't be too far behind.
yeah. But I think you have to have like a certain number of hours, right, in order to get a tax break.
Yeah.
And I don't know what the certain number of hours are. If working during flu clinic is enough hours, because you usually do maybe 3 to 4 hours a clinic. I don't know, and you do 4 or 5 of them, so maybe 20 hours may not be enough. But I think regardless, I think there are nurses, retired nurses out there that would be more than willing. We provide them with gloves, alcohol, and the medication, and of course the paperwork, because everybody has to have paperwork signed so that we can send it in. Yeah, and I bet we could probably tap into that.
Another big area for the Board of Health is restaurant management.
Yes. So restaurant management, I have a little bit of experience. I'll tell you my experience. So when I was a junior and senior in high school, I worked for, do you remember the Porthole?
Oh, God, yes.
Okay, I worked there. So I worked there to make enough money so that I could go to Northeastern. I also worked at the Hungry Lion. And I also worked for Gene's Catering.
Oh, God,
Remember
down on
Gene's
Central
Catering down
Street.
Central Street? So, yes. So I know a little bit about it. We had to clean everything. We had to make sure that all non-perishables were 6 inches off the floor, and 6 inches away from the ceiling. We had to put expiration dates on everything, so all our perishables, pre-made, anything in the refrigerator had to be marked, and it was marked with a 5 to 7 day expiration date. Seafood, like oysters, we kept the little tags so we knew what farm they came from, in case that there was salmonella or listeria or something, that it can go back to, we can track it back to where the fish came from. Washing, everything had to be clean. We had to separate everything. So if at Jean's Catering, if I was working on vegetables and salads, I had my own little place, and I didn't touch the meat. Somebody else had access to the poultry, and so we had cutting boards with a different color on them. So say vegetables were green, fish may have been white, poultry may have been yellow. So there was a separation. So, and we had to make sure that heated food was 140 degrees at least or better, and our refrigerators was 40, 41 degrees or less. So there was a lot of things that we had to do. And cleanliness was priority, making sure. And the other thing we had to do is be careful with allergens. So we had to be careful that if we had a client with a peanut allergy, or we'd let the cook know, so that we'd make sure that there wasn't any cross contamination. And I assumed that it's pretty much the same thing now. We had somebody trained in CPR. I was trained in CPR. And on choking. So there was always somebody around that had CPR training. And so I have, some experience with that.
Well,
and then at the Portuguese Club too, with our kitchen at the Portuguese Club, same kind of thing, making sure that everything was clean. Staff were cleanliness of staff, good hand washing, and being careful with cross-contaminations, things like that, yeah.
we've been fortunate that we had Paul Mazzucchelli being the newbie with only 3 decades of experience.
Yeah.
On day one, you're walking in, and there's been a monumental change, losing 3 or 4 people that had all the experience.
They had a lot of experience.
What do you do on day one, Rosemary, to learn?
On day one, so my intention is I want to speak to our 5 current employees that work for the health department. So I want to meet with Amanda, who's the director, and also meet with the assistant director, Lisa, and the 2 inspectors, which is John and Joan. So that's my first goal, is to actually sit with them, because I want to find out what they actually do. I know that there's a lot of regulatory stuff that they do with permits, and I didn't even think people still had septic systems in Milford, but septic systems and wells, and you have a septic system up there?
The whole area of
Oh my God,
Mill
didn't know
Pond.
that. So
We've
you use
wanted
a lot
sewer
of,
from
Ooh.
day one, but the granite in between us and the sewer system has made it so that they can't put in sewer.
Oh, see?
I would sign up for sewer in 2.5
I know,
heartbeats.
it's so much better. But you don't have well water.
No, we have water.
But thank God, you don't have well water.
We have water, but we don't have sewer.
Yeah, yeah. So anyway, so I know that they inspect, restaurants and tanning facilities and our pools, public pools and camps. There's a list of things that they do, and there's only like 4 of them that are full-time, and Mary, who is part-time. So it's huge. The job is huge. But the first day or the first month, I want to know what each member of the health department does. That's number one. I also want to sit, of course, with both Paul and Lori, and go over, what's going on. Because I try to get into the minutes and I can't find any minutes, but I see the agenda. So I need to like probably go back 6 months and look at all the minutes so that I can catch up to what's going on now. So it's going to be a lot of learning. At some point, I want to sit with Mark Nelson. I want to also sit with maybe the nurses in the school system. I want to look at, do they have any guidelines or anything, with emergency preparedness for anything unusual that may pop up? Do they have guidelines if there's an outbreak of measles within the school? So there's a lot. I have like a lot of things. I have a list of things. I can't do it all in a month, but I'm hoping to get it done. I think the first year is going to be a lot of learning, But I have a lot of ideas in my head. I have a lot of ideas because I'm listening to what people are telling me. Another idea of mine is I love the neon light sign that is down at the water company. But we don't have one where the town hall is. I would love to put a portable one out there so that we can put things on it that would be beneficial to our citizens, like the Hazardous Waste Day. Do you know how many people are always saying, when's that day? When's that day? I can't find that information anywhere. Just things like that, like Hazardous Waste Day will be November 2nd or November 3rd, or rabies clinic will be during this week. Things like that, because otherwise it's just nice so that people can see it and say, oh, we're going to have rabies clinic, April 3rd.
Can you use the town website?
People don't use the town website.
Yeah.
They don't. That's the problem. A lot of older people don't know how to navigate. They don't. They have smartphones, but they don't know how to navigate it. They don't know how to find this information. It'd be nice to even have like a newsletter that we can put together. Maybe add it to this. Add it to the senior center's newsletter, or something like that. But a portable sign is nice because when it's not in use, it's got wheels, you put it away. When you want to announce something, you bring it forth so that when people are driving by, they can read the sign and know what's going on.
I have a funny feeling that if you made use of a portable sign, you'd never put it away.
There's so much going on, and it doesn't have to just be Board of Health. It can be any of the departments. So it can be like early voting this week. Mail-in voting starts this week. You know what I mean? It could be something that's utilized, and we have to let people be aware of the good work that everybody's doing and all the services that are being provided, and let them take advantage of those services.
Now, this may not be a fair question, but have you had a chance to look at the home inspection program?
I looked at Article 37, if that's what you're talking about.
Yes.
Article 37. I looked at it. I called some people to try to figure out, is it still active? What's going on? So Article 37 came out, you correct me, was it 2016 or 2019, in that area?
It was in that area.
It was in that area, correct? And so it was a $50 charge for year one, and then after that it was $15 a year
after that.
And so homes were being inspected. What were they being inspected for? Overcrowding was the primary reason. Correct?
Yes.
Because you couldn't find an apartment or housing anywhere. It was overcrowding. But really, it was other things too. We have a lot of older homes, so it's lead paint, right? It's things like hoarding, because we have people that livable or unlivable, unsafe
Well, the scariest part that got my support was when you have a house, your house,
Yeah.
my house. It's set up to support a kitchen, lights, so you've got 100 or 200 amps of electric
Yes.
coming in. If you put 2 or 3 kitchens in, because you split the house into 3 apartments,
Yeah.
you're overtaxing the wiring, and
Yeah.
you're just setting up a fire hazard.
I was more concerned about one kitchen and, 3 bedrooms with 12 people. And now somebody gets sick, the
The
whole
whole house.
family, the whole house gets sick. That's what I was concerned about. But back then, yeah, I can see why we had to do this. Because back then, you couldn't find an apartment anywhere.
But aren't we
There
getting,
wasn't enough housing, but now there's plenty of housing. But the other thing too is people are really smart. So you had people that had multifamily homes, and then people started buying one family homes and using all those rooms as a boarding house.
yes,
So you had multifamily homes paying the price and getting inspected under Article 37, but one family homes did not. So,
and that was, when I asked back then Lenny and Kenny and Paul, what were the telltale signs?
yeah,
It was pretty obvious that the Board of Health were the first ones to know because, first of all, you see 7 cars parked in front of one house.
yep,
Second, you start seeing 3 trash buckets, 4 trash buckets filled in front of one
Yeah.
house.
Yeah.
And then he said if they went in, they saw padlocks on bedroom doors.
Yeah.
So right away, I mean, our teenage kids when they were young probably would like their own padlock on their door.
Oh, yeah, yeah,
But I mean, not being facetious,
yeah.
you don't need to padlock your door amongst family.
And I'm sure that neighbors started to see things and started making those phone calls.
Now, here's a philosophical question. Board of Health sees a home that looks like it's been brought into non-compliance by breaking it up into
Yep.
multi-family apartments. Should they rat them out?
Well, I think we have to give people a chance to correct the problem. You have to work with people. What's the old saying that you can get more with honey than you can with vinegar?
Catch more flies with honey than vinegar.
Right, right. So we have to give people a chance. Sometimes there are people that are just uneducated or unaware or just they're not aware of the regulations. And so if you can meet with them, discuss and say, this is why you can't do that, and give them time to fix the problem, then I think that that's a better option than rat them out. And who do we rat them out to?
No, that was the
Police?
question. Who do you call?
Who do you call? Call the police? Is it truly illegal to have more than 2 or 3 people use one room? I don't know.
Well, the biggest thing, as you said, was safety.
Safety, yeah.
You know,
Safety and health.
I mean, when you think of some of the immigrants, and
Yeah,
We
coming
have-
over with
we-
TB and you don't know it now.
we
Now
know
we
the
have a
Portuguese
TB
came
outbreak.
over, and some of the families were 10, 12 people.
Yeah.
They were living in one house, but it was one immediate family. And they would live together till they could afford to get a second house.
Yeah.
That, to me, is different from somebody renting out, making a boarding house.
That is, yeah.
Because they all could use one kitchen. They all, you know.
And then too, how did they get away with more than one kitchen? Did they get a building permit?
No. You couldn't do that, because if you got 100 or 200 amps coming in the house, and you're looking for another 60.
Mm-hmm.
I mean, a stove, an electric stove is 30 amps by itself.
So you rely on observation, you rely on neighbors calling so that you can investigate.
Have you had a chance to look at the success of the new trash program?
I know that in my neighborhood and neighborhoods around my area, it's working beautifully. I mean, the old days of just leaving trash bags out and then in the middle of the night, like I live on Madden Ave, coyotes would come, cats, and then there'd be trash all over the place, or you get a good windstorm and there'd be trash and recyclables down the street. It's better, it's healthier. You don't have the rodents. I think it's good for decreasing, the amount of rodent activity. I think it's working great. And I think, some people complained in the beginning, like, elders said, the recycling and trash bins are too big for them. I want smaller ones. And I think the Board of Health accommodated them and got smaller ones
Smaller
for
ones.
them. So I think they've bent over backwards to try to
Well, at the
make
end
it
of the
work
day,
for
we didn't have
everybody.
much of a choice. Because the first time the Board of Health came in front of FinCom for funding for this program, I was one of the people who was not pleased that it just was sprung upon us.
Yeah,
But then the next year, we found out that out of the 4 companies that were going to bid on our trash removal, 3 of them said if you don't use these standard bins,
We're not
they're not
going to.
bid.
so they provided,
They provided. Harvey came back and
Yes.
said, we'll allow you to stay with the bags versus the bins for 1 year, but we're going to
Yeah.
add $250,000 to the price. Okay, that changed my mind real fast.
and they paid for the bins.
And they paid for the bins.
So that's a win-win situation.
Yeah, the biggest thing was that you had 1 person per trash truck instead of 2. In the old days with the bags and box.
They'd jump off, they'd grab the bag,
Throw
and
it.
but now you don't need
But it
that.
seems to be working.
Yeah, it's working. It's working really well. In my neighborhood, you'd find me, now we get trash pickup on Wednesdays. You would find me with plastic gloves Tuesday, going up and down the street with a bag, picking up trash because it's my neighborhood. And now I don't have to do that. Because, and it was nobody's fault. It's just you got a little bit of gust of wind and you'd lose these plastic bottles everywhere. They'd be rolling down the street. It was nobody's fault. But
Well,
now
I remember
they're
we had the
secure.
problem with the neighbor's dog. Dogs aren't supposed to be let loose,
They're not.
but we went to the neighbor and said, every Thursday morning, my sainted mother is out there picking up trash because your dog is rifling through our bags.
Yeah.
And it was funny because they told us that she actually taught me a lesson. She said, it's your dog, it's your trash, your yard, your problem.
Yeah.
So I said, okay, that makes sense to me. So every Wednesday night, I put the trash in her yard.
Oh, geez. Oh,
And every
geez.
Thursday morning, my trash was all over her yard. Till I finally got a note saying, we got the message. I'm not going to push that you don't let your dog loose, even though that's not legit.
Yeah. Yeah.
But just keep him in Thursday morning.
yeah. Yeah. Yeah.
But it seems to be
Yeah.
working.
Yeah, no, it is working. It is working. I know recently there was I saw it on the Milford bulletin board. They recently had an issue with people took their recyclable and they put them in trash bags. And then they put the trash
Bags in the
yeah,
bins.
Yeah, and I think honestly people were unaware, and again, it's a lack of education, a lack of awareness that the trash bags were interfering with
They
the
fouled the machinery.
machines. Yes. And I think once people got that message,
I stopped putting anything in the blue bin.
yeah,
I mean, I'll admit, every once in a while, I'd throw a bag of cardboard or whatever in there till I read that and it said, okay.
same thing. We have a pellet stove, and so the pellet bags. So the pellet bags hold what 45 pounds of pellets, but it does have the recyclable little symbol on it. But I was throwing them in the recyclable cans, and now I'm like, oh, I don't know if I should, because they said all plastic bags, but I'm like, so I started putting them in trash, and I don't know if that's right or wrong now.
Well, it's hard. I'm torn when I go to throw something away because I'm reading that most of the recycle
Yeah,
is incinerated anyway.
yeah.
That since China implemented that 5% contamination ban,
Yeah.
that they don't take our recycle anymore.
It was China that was taking it?
China was the big user.
Oh, wow.
That's why we never paid anything for recycle. As a matter
Wow.
of fact, back years ago, we got a rebate on our recycle.
Yeah,
Now all of a sudden you're sitting there saying, I want to do what's right for the planet and throw it into the blue bin,
yeah,
but that's going to cost $130 a ton versus the gray bin, which is $80 a ton.
yeah.
And they both end up being incinerated in the same place.
Though, we could do better because, those recycling bottle places, and you pay what, 5 cents a bottle,
Yeah.
right? And then you wash your bottle out, you bring them back, and then they give you 5 cents back. People, it's too bad that people don't keep things separated and bring them back. And then those are really recycled back, aren't they? Don't
Well-
they wash them out and they really do recycle
I know that we
them?
separate the bottles out because of my granddaughter, because one of her kicks is to get 5 cents a bottle
A
back.
bottle. There you go.
So if she sees me throw a bottle into the regular recycle, I get chastised by it.
Because it goes into her
7-year-old.
piggy bank. And then she can buy that doll or something at the end of a few months. But maybe we need to be better about doing that, Because I don't do that,
Rosa,
and I
we're-
should.
We're at the point where I have to ask you a question.
Okay.
I'm from Milford. Why should I vote for you?
Well, I think my past experiences, I think that makes me the better candidate, number one. Number two is I am transparent. I am respectful. I am accessible to anybody. If somebody has a complaint, they can reach me. If I can't answer it, I am going to find out who can, and I'm going to close the loop of communication, and whoever that person is that trusts me, I'm going to make sure that the loop of communication is closed and they know what the outcome is. And I think lots of times we complain and then it's sort of like dropped and we don't know what the outcome is. And I think it's important to do that. So hopefully if you vote for me, you're going to get the whole package deal. That's
Well,
it.
thank you.
Well, thank you for having me.
Well, like I say, there's too many people who have opinions,
Yeah.
but aren't willing to put in the effort to make them happen. I appreciate that you're one of the others that
Thank you.
want to help.
Thank you.
And as always, thank you to our 6 loyal viewers for watching. I've made a promise that I'll never ask you to vote for a specific candidate, but dang, I'm going to beg you to vote. The last few elections, we've been averaging under 10% turnout. We need help. People like Rosemary, who not only have an opinion, have experience, but are willing to help, are critical. But even if you can't, at least take 20 minutes once a year and get out and vote. So as always, may God bless. May tomorrow night be a better night than tonight. Good luck in the election.
Thank you, and stay safe.